Down Syndrome Management Guidelines.
This video is presented by Solved Papers Pediatrics for PG Students, 3rd edition.
Hello.
Hi.
Please tell me about the consensus statement of EOP on the management of Down syndrome.
Sure.
Please tell me about the prenatal screening of Down syndrome.
All pregnant women, irrespective of their age, should be screened for Down syndrome, preferably in the first trimester, and prenatal diagnostic testing done if needed.
Okay, what about the child after birth?
Karyotyping should be routinely done for confirmation after the child is born.
How to monitor development and growth of the child?
The height or length, weight, and head circumference should be regularly monitored and plotted in a Down syndrome specific growth chart. It is the growth pattern that is important and not the percentile shown in the chart.
When to screen for cardiac lesions?
Routine screening echocardiogram should be done at birth and cardiac status established by 6 weeks of age.
What about the cases with large shunts?
There should be no delay in correction of large shunt lesions as it can lead to pulmonary vascular disease.
How to assess endocrine status?
Congenital hypothyroidism is not always picked up in the newborn screening. Hence, repeat screening at 6 months is recommended. Screening has to be repeated at the age of 1 year and every year thereafter.
Okay, what about subclinical hypothyroidism?
Subclinical hypothyroidism is treated only when the TSH remains persistently more than 10 milli-international units per ml, or if there are clinical symptoms of hypothyroidism or goiter, or if thyroid autoantibodies are present.
Okay, please tell me about audiologic assessment.
Neonatal screening is recommended, followed by a full audiological assessment between 6 to 10 months and intervention initiated if needed. An audiological review should be done at about 18 months in a manner appropriate for the cognitive level, which should be repeated at least yearly until age 5 and thereafter 2 yearly for life.
Okay, what about excessive wax in the ears?
Regular dewaxing is advised for wax accumulation.
Okay.
For otitis media with effusion, grommet insertion is advisable, with adenodectomy in case of recurrent issues. Sleep studies or polysomnograph may be done in the presence of suggestive symptoms where available, as there is a high prevalence of obstructive sleep apnea.
What about eye checkup?
All newborns with Down syndrome should have an eye examination at 4 to 6 weeks to exclude congenital glaucoma, cataract, and other eye abnormalities. Visual behavior needs to be monitored by a pediatrician before their first formal ophthalmological review.
Okay.
Between the age of 18 months and 2 years, all children should have an ophthalmological review, which is to be repeated at 4 years and thereafter every 2 years throughout life. Any child, adult with pain and or changing vision or visual disturbances, red eye, should be referred for urgent ophthalmological opinion.
When to assess blood diseases?
All newborns with Down syndrome should have a CBC and peripheral smear examination, which should be repeated yearly till 5 years.
Okay.
All children with previous transient abnormal myelopoiesis should be monitored for progression to myeloid leukemia with 3 monthly clinical review until the age of 2 years. If the CBC and peripheral blood smear are normal, monitoring should continue 6 monthly till the age of 4 years.
Please tell me about the Schim manifestations.
A thorough cutaneous examination with particular attention to the commonly affected locations like scalp, axilla, groin, and feet should be done at all routine clinical visits.
What about the musculoskeletal system?
Hip and foot examination should be done in the first year of life. All cases with a limp should be evaluated with a hip X-ray. Routine screening of the cervical spine is not recommended unless they are engaged in contact sports, have any symptom of atlantoaxial instability, or as a part of pre-anesthetic checkup. Scoliosis screening should be considered in the presence of suggestive findings.
K. Oral health.
First dental visit should be within 6 months of the first tooth eruption or by 1 year of age, and thereafter yearly till 5 years of age.
K.
Brushing should be done twice daily with a soft toothbrush and fluoride toothpaste. Preferably floss daily, even if there is gum bleed, as brushing and flossing help to keep the gums clean and minimize inflammation. Limit the amount and frequency of sugar and refined foods.
What about gastrointestinal conditions?
Complete physical examination of the infant, including inspection of the perineum for anal patency. Enquire about the passage of meconium. Growth monitoring as a screen for malabsorption. Consider testing for celiac disease if symptomatic.
How to evaluate genitourinary conditions?
A thorough physical examination to identify anomalies such as hypospadias, cryptorchidism, testicular cancer, and kidney malformations should be done. However, routine screening for renal and urological problems is not recommended. Postnatal follow-up should be done to rule out any renal problems if anomaly scan had showed any abnormality. A yearly testicular examination should be done.
What about puberty?
Caregivers should be counseled to prepare the children for pubertal changes. Menstrual hygiene should be taught to the girls at the appropriate time.
K. What about language and social development?
Functional language and social assessment to be done from the age of 1 year onwards. Instructions should be short and clear. Teach children to hear and imitate. Find their capability in sound discrimination. Parent-mediated intervention plans are encouraged. Social skills training in understanding social situations is beneficial.
What about vocational aspects?
Early intervention programs should be started at least by 3 months of age. ADHD and autistic behavior should be looked for early and managed. Psychiatric support should be given for the adolescents. Inclusive education in a normal school should be advocated. Vocational training to be initiated based on their aptitude.
How to do counseling?
Counseling should be initiated as soon as the diagnosis is suspected and after confirmation and full workup. A follow-up chart should be provided to the parents. A biopsychosocial strategy should be the basis of management, and the need to continue interventional programs should be stressed. Connect them to a local Down syndrome support group where available.
K. Thank you.
Please like, comment, share and subscribe.